Hello everyone and welcome. Today I would like to talk to you about chiropractic healthcare and what a chiropractor does. According to the WCA, the actual profession of chiropractic as a distinct form of healthcare dates back to 1895. In this year, Dr. Daniel David Palmer adjusted Harvey Lillard, a janitor with a hearing problem, eventually curing him and returning his hearing back to full function. He also is responsible for coining the term chiropractic. Chiro means hand and practic means practice or operation. With the help of Dr. D.D. Palmer, chiropractic has developed into a full freestanding form of healthcare. The main philosophy of a chiropractor is to utilize a treatment method that seeks to help the patient restore normal physiological function. This in turn helps the patient improve his or her health. Chiropractic is known as being a conservative form of healthcare, meaning that they believe that the body heals itself without any intervention of medications or drugs. Chiropractors believe in trying to get to the source of the problem, feeling that medications only mask the symptoms that you have. They think that the body has the power to heal itself. For example, a chiropractor would say that if you were to cut yourself and you're bleeding, that the body actually heals the cut and the band-aid that you put on that cut does not. Now, the main purpose of chiropractors is to correct subluxations. The ACC, the Alternative Care Chiropractic, explains subluxations as being minor misalignments or biomechanical malfunctioning of the vertebrae. In order to fully understand what chiropractors do, you must first understand the anatomy of the human body. Now, what I have here is a picture of a subluxation, and this is the vertebral column, and what's indicated in white here are 4 vertebrae, and these colored items, the yellow, orange, yellow, are spinal nerves. Now, when a vertebrae is subluxated or misaligned, it'll pinch one of these spinal nerves, which is indicated in orange. And that is what a chiropractor finds when he feels down your spine. He feels this misalignment or this pinched nerve. And that is known as a subluxation. Now, the other part of the anatomy that you need to understand is that the brain controls every cell of the body. It sends nerve impulses down the spinal cord and out the spinal nerves to every tissue in your entire body. And what chiropractors try to do is adjust the vertebrae that corresponds to the respective spinal nerve, as I showed here. For example, if you have numbness or tingling in your thumb, a chiropractor will trace that nerve back to the spinal column to relieve that subluxation on the vertebrae that's impinging the nerve. One way chiropractors can find certain subluxations is through the use of a device called a nervoscope. Now, the nervoscope is a dual probe instrument that detects temperature on each side of the spinal column. So a chiropractor will take this instrument, and it has a temperature gauge on it, and a subluxated vertebrae will be inflamed and will have a greater temperature on it. Now, when he takes this instrument, he'll run it down the spinal cord, and the temperature gauge will tick at any sign of inflammation, and showing a temperature of the vertebrae, leading the doctor to the problem. Now, chiropractic is becoming more and more popular as a form of alternative healthcare. According to the CCE, there are approximately 60,000 doctors in the United States, and there are more than 10,000 students that are currently enrolled in chiropractic educational programs. Now, the world of chiropractic is growing larger and larger every day, and has shown an increasingly higher acceptance due to the studies that show it is the most helpful and cost-effective treatment for a variety of conditions. Thank you.